Hi, Dr. Jennifer Tang here from Tang Personalized Medicine. Today I want to talk to you about something called mast cell activation syndrome, also known as MCAS as the acronym. It is something that we often see in combination with hypermobility and Ehlers-Danlos syndrome. Mast cells are actually a very primordial part of your immune system. They live in your connective tissues and they react non-discriminately differently from antibodies. Any foreign intruder, they will non-discriminately release their inflammatory chemicals, which include histamine and prostaglandins and interleukins. So as a result, you can get symptoms that can affect many different organ systems. And in fact, the definition of MCAS is that two or more organ systems are affected. Most commonly, we might see cardiovascular symptoms causing low blood pressure, increased heart rate, or lightheadedness or syncope. We can also see skin manifestations such as itchiness, hives, and flushing, respiratory, pulmonary symptoms such as wheezing or shortness of breath, and very commonly gastrointestinal symptoms such as abdominal pain, diarrhea, nausea, vomiting, bloating, especially right after eating. There are many different triggers that can cause the onset of symptoms of MCAS. Many people with MCAS are sensitive to temperature changes or have heat or cold intolerance. For myself, I have cold intolerance, which is why I now live in Southern California. If you have noticed that you are intolerant to many different types of medications, it may not be that you have a true allergy. It may be that you have mast cell activation syndrome. Foods can also cause MCAS symptoms, especially foods that are high in histamine. And you may notice that you can eat something, but then if you keep it overnight and eat it the next day or the day after as leftovers, then you get a bad reaction because leftovers build up histamine. Stress and physical exercise can also be triggers. Many people with MCAS have post-exercise malaise or fatigue, and that can be very limiting in terms of physical activity. Alcohol and infections can also worsen MCAS symptoms, and also physical stimulation such as pressure or friction. For me, I know I tend to get hives with any clothing that puts a lot of pressure on me, and especially with latex elastic. Usual treatment of MCAS involves a combination of antihistamines, mast cell stabilizers, and other medications that can help to control symptoms. This is something that should be discussed with a healthcare provider who is familiar with mast cell activation syndrome. Unfortunately, it can be hard to find that provider. There are many allergy immunology specialists who are familiar with mast cells, as well as hematologists. And of course, doctors like me who treat EDS and hypermobility would be familiar with MCAS as well. A common misconception about MCAS is that if your tryptase level is negative, you don't have it. Now, this is not true. There are many different factors that come into play when it comes to checking a tryptase level. First of all, timing is very important. You want to check the tryptase level ideally 30 minutes to 2 hours from the onset of symptoms. And sometimes it's really hard to get to the lab in time to catch that window. Also, it's important to have a baseline tryptase level for comparison. The baseline level would be when you're not having symptoms. There is also a condition called hereditary alpha tryptocemia, which affects 5 to 7% of the general population. In these patients, baseline tryptase can be elevated and can interfere with the test results. It's also very important for me to add that this information is for educational purposes only, not meant for you to diagnose yourself. If you've learned something here that makes you suspicious that you may have mast cell activation syndrome, please see a doctor who is knowledgeable about this. I am available for diagnosis and treatment of patients in California who are over 18, and I am also available for consultation to those out of state for educational and coaching purposes.